can I have an on-block total capsulectomy if I have obstructive sleep apnea diagnosis and CPAP issues? Okay. Kind of like, I find a lot of these questions, I kind of say it depends, but I think that's because it's hard to give a straight answer. I remember when I worked in A&E, one of the nurses, when people rang up, people would ring up the A&E and say, what's the waiting time? And the nurse would always say, well, it depends. You know, if you've stubbed your toe, it's 4 hours, but if your heart stopped beating, we'll see you straight away, sort of thing. You know, it kind of depends on what the problem is. And so this, in relevance to this question, it kind of depends why you need a non-block total capsulectomy. So if you need a non-block total capsulectomy because you've got cancer, well, yeah, you can have it. You know, your risks are increased if you've got of having an anesthetic if you've got obstructive sleep apnea and you're using CPAP. So the risks are increased of post-op respiratory problems. So you know, but then they are not absolute contraindications. So it would depend on the indication for the surgery as to whether the complications associated with your sleep apnea outweigh the risks outweigh the benefits or not. And really, it's an anesthetic issue. Well, I guess surgery as well in terms of the indication for the surgery. So the surgeon will be involved in terms of the indication for the surgery and the consequences of not having surgery. So you have to weigh up the consequences of not having surgery versus the consequences of potential complications of having surgery. So yeah, I would say not necessarily definite no, but it would need a discussion with the anaesthetist to see if the anaesthetist was happy. And in this day and age, we need to see if the hospital's happy as well. So check. It would certainly need discussion. It's not going to be straightforward if you've got CPAP. That's not straightforward at all.